23rd of November. This is budget hearings for 2016 budget. And Zach, if you would begin by introducing yourself, we'll go this table and then start that way, and then you guys can start.
Zach Taleric, Director of the Office of Management and Budget.
Victoria Caldwell, Acting Clerk for Board of Commissioners.
Marilyn Brown.
Paula Brooks, County Commissioner.
Kenneth Wilson, County Administrator.
Eric Janis, Deputy County Administrator.
Chris Long, Deputy County Administrator.
Catherine Carter, Vice President of Clinical Services at the Office of Revenue Control.
Jonathan Wiley, CFO, Adam H.
David Royer, Director of Adam H.
Ken Graham, Director of Homeland Security and Emergency.
Jeff Stillhart, Chief Deputy Sheriff's Office.
Thank you. We're here to talk about our Stepping Up initiative, which is a joint initiative of the, nationally, it's a joint initiative of the National Association of County Governments and the National, the Sheriff's Association, and the, locally, we have a grant with the Office of Homeland Security and Justice Programs, and we have all of the partners here at the table ready to talk about it. So, if you'd like to start.
Thank you, Commissioners. First, before I talk a little bit about the Stepping Up initiative, on behalf of our board, we want to thank the Commission, the staff, for your support and leadership on our recent levy, issue 14. It was a renewal levy. Obviously, we're pretty humbled by the fact that we received the level of support we did from the Franklin County voters, and we appreciate your support. I think it also speaks about how this community views the issues of mental health and drug addiction. And unfortunately, all too often, there is that intersection with people that we serve and the justice system. So today I thought what I'd do is just really kind of talk a little bit about some of these major initiatives and some of the accomplishments over the past year, as well as some of the new things that we'll be doing. You know, as we look to expand our services within the Franklin County criminal justice system, I want to mention some of the work that we're already doing. On this year, we supported over 45 programs at 16 providers, totaling $4.6 million, and reaching nearly 6,500 consumers of mental health and addiction. These programs vary from outpatient counseling to residential care program. With regards to these investments, there are just a few of the programs that I think I'd like to try to highlight on. The first is opiate and heroin services. As we know, the opiate and heroin epidemic continues to be on the rise, and it's hit all areas of Franklin County. It's provided numerous challenges to the suburbs, younger adults, and to our system as a whole. I happened to be looking on a journal article today, and one of the things that was quite striking was the growth of young women who are becoming opiate dependent. As a percentage over the last 10 years, it just continues to explode. We all know that all too often these people that are suffering from these addictions may end up in a jail. We currently invest over $9.7 million in opiate and heroin related treatment services, including detoxification, ambulatory detoxification, medication assisted treatment, as well as inpatient treatment. Pending approval from the board, we plan to expand our capacity in detoxification services at Maryhaven, as well as medication-assisted treatment. The additional capacity is going to allow us to serve more people in our community who suffer from heroin and opiate addictions, and to better address this emerging epidemic. Another program that we've had in place for a while that I think is really an important community cornerstone to any initiative is the Crisis Intervention Training Program known as CIT. We partner with NAMI Ohio, National Alliance of Mentally Ill Ohio, National Alliance of Mentally Ill Franklin County, Mental Health America, as well as NetCare, and the Columbus Police Department to provide trainings to Franklin County law enforcement. CIT officers learn how to effectively manage a crisis situation, and they make sure that people who need mental health or substance abuse treatment get their treatment needs met, possibly avoid going into jail. Since the first training in 2003, 778 law enforcement individuals have been trained, including Franklin County Sheriff's deputies and dispatchers. Of those, 714 are sworn officers. I can tell you, I believe now we have every jurisdiction, at least one CIT officer from every jurisdiction in Franklin County. The current plan is to run 4 new additional trainings this year in this coming year in 2016. We also do a lot of work with the specialty dockets under the leadership of the various courts and with the judges. We work with every level of court, domestic relations, juvenile, as well as the Court of County Common Pleas. These specialty dockets provide a lot of treatment and that they need while reducing costs and lowering the recidivism rate. A special thanks to the judges who do this. It's above and beyond their normal judicial requirements, and I will tell you that the judicial involvement with many people that are struggling, that have come in and out of the criminal justice system, it makes all the difference in the world when we have a judge who engages in what can we do for you, not what we can do to you. So I want to thank those judges. Under the new initiatives, one of the things that we want to do is continue to work with the justice system, and as you know, we all work together with the Council of State Governments about the challenges facing Franklin County, including the large number of people that surface inside the system with mental illness and they cycle in and out of the jails. We worked with the Council of State Governments, reviewing and analyzing the data, and they developed a set of recommendations to which you're well aware of. As a result, we have signed on as a partner with the Stepping Up Initiative. On December 7th, our Board of Trustees will vote on an action that will begin the Franklin County Justice and Behavioral Health Initiative. This project will establish a jail assessment and liaison team and expand capacity for integrated dual diagnosis, assertive community treatment teams as an evidence-based practice that we have shared with you on previous occasions. It's also going to provide some funding for Legal Aid Society of Columbus. There's all too often many of the folks that that cycle in and out of the jail. There are barriers to successful community integration, and we think that's this is an important piece to that initiative. The goal of this collaboration is to provide intensive engagement services for those incarcerated within the corrections system, as well as linkage and relinkage where appropriate. And we want to thank, obviously, the Sheriff's Department and Chief Stobart for his leadership in starting to, as we put these pieces in place. We're hopeful that this project will begin in January 16. It's on the agenda for the board, I think 2 weeks from today, and a lot of the pre-planning's already in place. As I mentioned, we're also going to expand some medication-assisted treatment. In addition to the aforementioned programs, we're increasing the capacity for individuals identified inside the justice system. It'll provide Vivitrol injections to individuals who are opiate addicted prior to leaving the jail, as well as ongoing treatment supports. Vivitrol is one of 3 medication-assisted treatments that we embrace, in addition, the other 2 being, of course, Suboxone and Methadone. Finally, before I wrap up my section, I just want to mention that this past week, the Dispatch concluded an important 6-part series about suicide. The series highlighted many of the issues around suicide and suicide prevention, including stigma, public education, and the lack of resources. I want to assure you that we will continue to invest more than $3.2 million in local school districts to address issues related to mental wellness, emotional well-being, substance abuse prevention. Each of these new investments is being implemented at a school building at varying levels of the school systems, and many include suicide prevention. We hope you will continue to support Nationwide in their suicide prevention initiative. It's an important partnership for us. In addition, we obviously do a lot of work with North Central in providing suicide prevention hotlines. Believe it or not, over 9,600 calls on the suicide prevention hotline were received just this past year, 2014. We'll continue to work with our partners on developing a more comprehensive suicide prevention strategy. We, as many people, believe that every suicide is preventable, and all too often when it does, and it was evidenced in this article, this series of articles, it is a devastating event that ripples far past just the immediate family. So while we continue to work on our justice initiative, I just want to thank you again for your continued leadership and support of what we care about, and we continue to look forward to working with the Office of Homeland Security Justice Programs, and as well as with Chief Stovart in trying to build a better mousetrap for 2016.
Thank you.
Good. This collaboration, this partnership, this synergy, and the energy that surrounds stepping up has been absolutely amazing. Obviously, the weight is sitting on the Adam board, their experience, their expertise, their collaboration has been above and beyond, but equal to all of our other partners. Obviously, the criminal justice system starts on the street with that discretionary decision that law enforcement officer or EMS may make. And second step, unfortunately, the vast majority of the time ends up in Chief Stovart's correctional facility. Commissioners and staff, 2 years ago, in partnership with Council of State Governments, the Franklin County leadership of the criminal justice and behavioral health systems initiated a systems improvement project aimed at identifying and reducing the number of people with serious mental illness in the criminal justice system. We had 8 months of data collection, 4 rounds of focus groups, and exhaustive quantitative data analysis that resulted in 4 core challenges for Franklin County. First, more than half of all adults entering jail return within 3 years of release. Second, information on risk and needs is not systematically collected nor used to make informed decisions. And third, people with behavioral health disorders stay longer in jail and return more frequently than those without behavioral health disorders. Finally, many people with behavioral health disorders who are released from jail are not connected to treatment or to community for support services that are necessary for them to succeed in reentry. The recommendations to address those core challenges were offered in the final report and accepted by this Board of Commissioners in May of this year. In addition, the board committed to develop a plan for 2016 to 2020 with measurable outcomes, implementing research-based approaches to advance the plan, and to encourage public-private partnerships that promote awareness and enhance community safety, assigning accountable staff and creating a process to track that progress. As a broad collaborative that includes all representatives of the criminal justice and behavioral health enterprises, we have written 6 grant applications. We've received 3 awards totaling just under $1 million. We've made tremendous strides in just the 6 months that we've had, and I'm pleased to provide you the following specific updates on our Stepping Up Challenge. The Franklin County Criminal Justice Planning Board stepped up, and their strategy has been rewritten to specifically address the Stepping Up initiative as one of the 3 board priorities. The Franklin County Reentry Coalition has stepped up by holding a retreat to facilitate a revised plan to include the Stepping Up initiative. The commissioner stepped up to approve by resolution a reentry service specialist to be added to my staff to provide assessment, case management, and identified service coordination. We are requesting the commissioners to step up again to approve a second specialist for reentry in this 2016 budget to make that vital link to the community services, and again to provide assessment, case management, and coordination in and out of facility. Chief Stovart stepped up to solicit and receive core CIT training from the National Institute of Corrections for corrections deputies, and BJA has just awarded the county another approximately $250,000 to increase our CIT training, not only for law enforcement, but to ensure that our 911 dispatchers have CIT training and understand what we're up against. Our EMS from the fire side, who are oftentimes first or second on scene and have to make the same discretionary decisions, as well as our private hospital security. That private sector is where we go when we divert from the government system. We've brought them into partnership, and Chief Stovart will talk about those initiatives in just a minute. As a broad coalition, we've stepped up to perform outreach and education on the CSG initiative with public and private partners. We have solicited feedback, opinions, and we continue to hold focus group sessions to identify priorities and support collaboration. And we do this, my office facilitates the entire collaborative, all of the partners coming into these meetings and then holding theirs with their sector of providers or users. Catherine Carr-Hurd leads Adam Stepping Up through grant writing and has identified funding to support 2 full-time employees to serve as jail liaisons and work in the correctional facilities to perform assessment for persons with severe mental health issues, developing a coordinated treatment plan with recommendations that can go to our judges that will facilitate moving these folks out of the criminal justice system a whole lot faster or completely if they ought not be here as assessed. Our departed Director of Job and Family Services, Anthony Trotman.
Still living.
Still living, yes.
Just wanted to say-
Departed from the county, how's that? I didn't wanna say our ex-director.
I
This is
know.
not that either.
Former.
Anthony stepped up and said, I can find staffing for 2 navigators to be in the courthouse,
Yeah,
to
that was
work
great.
with probation, to see that people are, number one, connected to ACA, as required with Medicaid, but also to be assessed and interviewed for what other core services are they entitled to that they didn't know that they could receive. Molly Gauntner, Chief of Municipal Probation, stepped up to take the lead on a state grant application that resulted in grant funding of almost $600,000 to implement pretrial assessment for these folks instead of being in jail for 60, 70, 90 days before an assessment is done that says, oh, this person really ought not be here, they're not competent to go through the criminal justice process. We can do this up front now.
Does that save money?
It absolutely
Mhm,
does. It
mhm.
saves money
It's important
because
to
number
save.
one, it's going to divert folks perhaps completely from the jail.
Mhm.
Certainly gonna move them a lot sooner. It allows the judges to have a much more comfortable assessment of not only what's the issue,
Mhm.
but what are we gonna do if I release this person from the jail? What's the plan out in the community
Right.
to ensure that they don't repeat? What's the best that we can do? Offered that, the judges are much more willing to say, we're going to release, because we can say, we're gonna release them with a plan in place, with assistance, and hopefully with connectivity to the community to ensure as best we can that we've done all we could to properly address whatever this issue is.
And
We
to
can't
keep-
do that in jail.
And to keep both the public safe as well as
Absolutely.
them safe from harm
Exactly.
to themselves or whatever, yeah,
Exactly.
right.
We, along with the county sheriff, stepped up to apply for and received a grant from the Bureau of Justice Assistance that will provide additional CIT teams training for social workers, case managers, for EMS, law enforcement, and our corrections officers, so that they all see what the other person is doing, so that collectively we have a plan. Our private sector partners, including hospital security, psychiatric nurses, the probate court, and EMS, have stepped up to participate in lead planning and training to ensure wraparound service provision. In our first caucus with the partners, it was EMS that stepped up and said, I have an idea of how we can address this across the spectrum.
That's great.
Wonderful partners. County administration has stepped up to include outcomes and progress reporting bi-monthly and incorporating stepping up into our staff reviews. And collectively, we've stepped up the standard for data collection, activity reporting, system review. We're developing a standard for communication and collective reporting to ensure that the data collection is timely and consistent, with the needs we all have to support informed decision-making as we move forward and institute these programs on a permanent basis. Franklin County's had a unique opportunity to be a funding and founding partner in the National Stepping Up Initiative to reduce the number of people with mental illness in jails. Our work has influenced several other jurisdictions. We receive calls on a regular basis from other cities, other counties, other states. We set the standard, and it is one that has influenced the state of Ohio under the leadership of Justice Stratton to move forward themselves and to embrace stepping up.
She was a real pioneer in all of this.
Absolutely,
Yeah.
for years.
Yeah.
Michael Daniels with Commissioner Brown's office has stepped up to lead our Franklin County partnership with the state of Ohio on their journey to make it successful. I'd like to take just a couple of minutes to let Chief Stobart talk about all the changes that have occurred in the corrections facility and the impacts that he has experienced with the Stepping Up initiative.
I don't think you have that much time.
We don't.
We'll start with, just to start with CIT.
She said a couple minutes.
CIT has been incredibly successful. We are one of only 9 counties in the country that has brought in CIT specific to corrections. We've seen some recent outcomes out of this already. The training ended in November. We've seen over 40 documented CIT incidents within our facility. Just in that brief time period, all of those having good outcomes. So we're very excited to continue that process and we'll do that with our partners sitting here at the table. Our hope is to continue to train as many staff, both civilian and uniformed, as possible within the corrections division. We will continue to offer this training to as many people as want. There are some intricacies about CIT and CIT training that we kind of force folks to do if it's not something that they're interested in. We've had an overwhelming response of people that wanted to be involved. Our first class, we trained 24 folks. The first CIT training was brought to us by the National Institute of Corrections. We have a waiting list of over 75 people that want to be involved in that. So we think we can continue to push this and push it well. Just a few of the other things in the Stepping Up initiative that tie directly to kind of what we're talking about. The commissioners have approved and funded objective classification system for the jail. That is the cornerstone for everything that we're doing. The objective classification system is a system that we will use to classify our inmates so that we properly house them within the facility. What that also will include is a brief mental health screening that's going to be done at intake, which is again one of the recommendations coming out of the governance report. Another piece of that was the Texas Christian University's drug and alcohol assessment. That is also a piece of the North Point program that is coming to Franklin County here very soon. The first deliverable from North Point is actually due Wednesday. They should come back with the staffing assessment, I believe, on Wednesday, and that will be shortly. On top of the objective classification system is a geomanagement system. We talked about data and data collection and how that was such a difficult process, kind of moving through this Council for State Government's project. The new geomanagement system will collect a great deal more data. It will be much easier for us to search. It will provide us with usable data moving forward. All of that's very important. One of the other recommendations coming out of the Council of State Government's report was to enhance our medical and mental health services within the jail. We have, as you well know, pushed out an RFP for a one-stop shop medical provider that will greatly enhance not only our medical and mental health services, but will also provide us with an electronic medical record system that will allow us to more easily cooperate with our community providers. All of that's very important. And I guess the biggest, most important thing is obviously building a new jail. Working very hard. We've had our first round of meetings with the architects. And every piece of design in this new facility is being done with the Stepping Up initiative in mind. So that we're creating a jail and creating an environment to better house those who end up having in our facility, and hopefully, we would prefer they get diverted somehow, but if they don't get diverted, then we have a way to couldn't prepare a bunch of stuff. I figured if you guys had questions, you would ask me. That's really all I have at this point.
So, the Stepping Up initiative has been huge. It has taken the front stage for the last 6 months, but I would be remiss if I didn't say we have 6 other major programs that come out of my office that also have to have the attention and the facilitation and the funding to support the overall criminal justice, juvenile justice, and homeland security enterprises here in Franklin County. So I'm going to take just a couple minutes to update you on supervised visitation and exchange. We had 113 families receiving services in 15, 160 safe exchanges, 1,700 visitation hours. I bring it up because they have applied to the commissioners for community partnership funding. We are working with the judges in the domestic and juvenile court to say there has to be a permanent funding solution. We need to find that solution and find it soon. We have grant funded this since the inception at the commissioner's direction for the past 5 years. And the criticality of safe exchange and supervised visitation is part of a successful reentry. It's part of knowing that we have assessment for behavioral health, and there is a way to bring these families back together or to offer safe visitation and exchange leading to reunification if it all works together. But I am asking for your support on the request for community partnership for that initiative until we can get it through the courts to find that permanent funding stream. Lethality assessment, of course, is one of our major initiatives. The reality that on average, 3 females and 1 male are murdered by their partner each and every day in the United States. The lethality assessment program was launched in June of this year, spearheaded by the Columbus City Attorney's Office in partnership with all law enforcement in Franklin County, facilitated solely by my office for the sake of collaboration and bringing this program to where it is with choices. As of October 1st, 15 Franklin County law enforcement jurisdictions have had their training entered into an MOU and are fully implementing the LAP within their communities. Since the inception, 1,156 LAP screens. That means there have been that many confrontations with law enforcement in a domestic violence situation where they believe that there was reason to connect the victim to choices immediately because the lethality potential was so high. 822 victims that they checked, marked the boxes for. 822 of those 1,156 scored out as high risk, indicating they were in danger of lethal or near lethal harm by their partners. So our goals for 2016 will be to expand the number of law enforcement partnerships and then do an evaluation of the raw data to demonstrate impact beyond the prevention of DV, beyond the prevention of homicides, and hopefully to get to that front end before we have a domestic violence situation to prevent the DV situation. The Victim Intake Center is our newest assignment. The Victim Intake Center is one that when a victim comes into the process here in Franklin County, it's terribly confusing, it's frightening, and we lose the victims. The victims either give up because they can't find where they're supposed to go, who they're supposed to talk to. They have no idea of the process of how to get a protection order without confronting the person that they need the protection order from.
Or file a complaint. We saw, perhaps many of us, CNN's last night, The Hunting Ground.
Yes.
And the travesty of justice that occurs when victims don't know where to go and who to trust and how to file.
Franklin County has stepped up on that one, and we are creating a victim intake center to support the centralization of a protection order hub. We have facilitated partner meetings to develop the business model. To date, 9 meetings have been held with the partners from the city and county who are part of that. Melissa's spearheading that to discuss logistics, security, staffing, oversight. It's anticipated that Melissa will produce a final business plan for us, and it'll be ready by the end of 2015 for implementation in
Great.
2016 early.
Great.
Correct, Melissa? Correct.
She's nodding back there.
She's back there. So we will finalize that business
Great.
plan, take a look at amendments, and then address the budgetary needs as I'm looking at my boss and the director of OMB. The monetary needs, budgetary needs that may be required to make that build out. Our volunteers in public safety support, to date, 190 have graduated from the academy, providing over 1,270 hours of volunteer service in 2015. We outreached for the first time to the new Americans, the immigrant and refugee community, for a specialized program. That cohort will include recruits from Bhutanese, Nepalese, and Somalia. We will continue again in 2016 in hopes of holding 3 classes, one for special needs, including the deaf community. Public-private partnerships, I have asked you in this budget to line item the public-private partner contract consultants. We have had Fred Bowditch on grants for 4.5, 5 years now. And Commissioners, this needs to be a permanent line item. I'm asking for that position to help do the training, the planning, the exercising, leading the collaborative efforts, community outreach and education with special attention to the immigrant and refugee communities that are at high risk. We need to counter that violent extremism. It's very real. Therefore, this unit is required to have secret clearance and to have law enforcement background understanding what violent extremism is and radicalization efforts that have already been made here in the Franklin County community.
I'm summarizing. We're running out of time here.
Training and professional development, we held 7 trainings this year for 199 of our terrorism liaison officers. We trained in automated license plate reader analytics. We trained operations-based threat, risk, and vulnerability assessments, bomb-making awareness, and the FBI came in with their LEAP training program. The Reentry Coalition completed the 2012 Second Chance Act Technology Career Training Demonstration Projects for incarcerated adults and juveniles with career pathways to success. We've strengthened our partnerships with community agencies, faith-based leaders, legislative leaders, and the restored citizens. And these efforts have expanded to include local, state, and national levels of influence for the enhancement of reentry initiatives. Primary goals for reentry is, again, to complete the new reentry plan. It's a 5-year model for comprehensive strategic planning, to implement the Justice and Mental Health Collaborative Grant that we just received, and to work closely with CMAJ and CSH and other housing providers. We have to expand the housing opportunities for folks. We are beyond crisis for justice-involved individuals in their homelessness. The Violence Against Women Act, we received an award of $542,000 for our local projects. We did nothing but continue the projects that were already in place, all producing highly successful results for less money each and every round.
And we've been cut millions of dollars in that.
We have in our grants
Right.
across the board. My next topic, being the Title II, Juvenile Justice Delinquency Prevention, there too. We have $100,000
That's it.
is all we're getting in grant funding for youth. And it is by state demand required to be focused on disproportionate minority contact. So,
Kathy, how does that work? You know, it seems to me we hear about youth radicalization. We've heard with what's happened in Paris that many of those young men were criminals. So don't you think we ought to be talking to our Congress about focusing some of these funds, preventing youth offenders, and figuring out where those ties might be in radicalization?
I just received an email a short time before this hearing That is required letters for the commissioners to forward to the Congress as they look at the budget for both Homeland Security as well as Justice, to say the grants coming to the local governments have to be sustained and increased.
And increase,
We cannot
right.
continue to be the boots on the ground to do the prevention as well as the response and handle the recovery if you don't help give us the funds needed. So once again, I will send that forward to
Great.
the board chair to take a look at.
Could send it to all of us, yeah.
Happy to do that, ma'am. Public safety communications, well, we know where that is. Our migration, we're down to the final steps of moving the last agencies over and testing to put everyone on digital. And 911, which Commissioner O'Grady chairs. We have agreement with all of our PSAP partners across the county for consolidation and for moving forward to digitalize and move up to next generation 911. Our final step in 911 is updating that GIS database, which you know is so critical to make sure that when a 911 call comes in, we know where it goes. That's very difficult
Absolutely.
to do when you don't have landlines or phone books.
Right.
But we're gonna make that upgrade to next gen, and folks will be able to use a cell phone to call 911, and we will be able to send response exactly where they are located. So,
Lots going
that
on.
A
wraps up
lot
where
of,
we're at.
a
It
lot of
is-
information, and I know we haven't even scratched the surface with all of you, but thank you. And we have all of your budgets here and all of your remarks that you've provided. Thank you all for all that you're doing.
Just keep up the good work.
Thank you.
Commissioners, thank you for your support and leadership.